I'm Melissa DeDomenico-Payne, and currently I'm a grants manager at the local community college. I'm also a town council member. I have been involved in one way or another with the coalition since around 1997, so close to the time that it was founded. And I have probably held every kind of little role that you can have with the coalition. I've been just a member, I've been a board member, I've been a committee member, I've been engaged in different activities with them. My daughter got some services from them. They contracted with me for some work and helped me get some work. So it's really been a great connector for me, a great community organization. I've been happy to see how it's progressed over the years. I was director of a nonprofit, and at that time, one of the key things I was doing is I tried to connect with whatever groups I could to sort of learn the landscape. At that time, the coalition was operated from the hospital staff. Denise Easom was coordinating it. In those days, I believe I was participating more in like needs assessments and just networking. Later on, I became involved in some of the recruiting for one of the previous directors. And then when I was living out of the community for a while, I came back and facilitated with the board. I facilitated a retreat with them. And then when I returned to the community to, again, be part of a nonprofit, I got very connected with Krista. She was really taking it in a much broader direction. I really, as they began to get more federal funding and blossomed into a lot of different services, I became able to be involved with the mental health conference, with Celebrate Kids Day. One of my testimonials is that I had developed cancer, and Krista was really supportive of me during that time and helped me get connected actually with Big Brothers Big Sisters to work for them, and also got me side jobs that I could do while I was having that. It was very instrumental to me personally to have that connection with community, and it's different than other community groups in that it's so broad in terms of health of the community. It has really evolved into many different facets, and I've learned so much how they approach in many different avenues and really find different ways of engaging so many members of the community. So that's been really, really great. And then again, my skill was grant writing, so like I said, we worked on some grant projects. I did some marketing projects for her as well. And my daughter was having a tough time. Recently, she was diagnosed with ADHD, and we did then, which is very late in diagnosis. And so she was struggling for a while, particularly since middle school, and she had some really bad experiences, and I found out about Project Courage, and at that time we weren't sure what route we were going for counseling, and anyway, counseling you can't get into for several months at a time, particularly with my insurance is Kaiser, so that's not even local, so it was a real conundrum to try to get her services. So in the gap, until we could get her into more, stable sort of counseling, we utilized Project Courage, and it was a good fit for her. She was connected with a mentor, and that has really been beneficial. And they, again, even helped me as a parent, look at different things, and helped me when I decided to actually move her from public school into a private situation, helped me, examine some resources. So again, service recipient, service giver, volunteer, board member, so like the full range. And then recently, of course, I've been on the town council, and I've been in a position to be able to be supportive of their initiatives that they put forward, which, around the recovery centers, and I'm really glad that they're positioned. So I always have utmost confidence in the coalition because again, they are so well connected with the community across the broad spectrum of service providers. And I think that's where it's so valuable, because it allows people to connect with each other, understand each other, and really focus on a broad agenda that is applicable to many, many people. It's a great environment and a great way to connect and learn. Mental health and substance abuse are of interest to me. Most people probably don't know this. My father had schizophrenia, and it was drug-induced. He was in the 1960s, you're a hippie that didn't come back from it. So it's near and dear to my heart, that people who are suffering from those issues get the treatment that they can, because out there are family members who, even if you're not, I was fortunate in terms of I wasn't necessarily raised with him, but years later connected with him. So I was able to really just enjoy the good parts of him. But there's always family out there. There's people that love these people that are struggling. So I love that their approach, the coalition's approach towards people who are incarcerated, towards people who are, suffering from issues that are not very pleasant to deal with. The coalition, views everyone as a whole person and tries to do what they can to be helpful to people and be a connector. Unlike some other organizations, the coalition is a preventative organization, and it's focusing on the most basic aspect of prevention, which is children and youth, and making sure that they have what they need as early as possible to be able to grow up into community citizens that can then in turn give back. It focuses on the easy things in some ways that we can do. It doesn't always have to be a big elaborate federal program to be effective. It can be as simple as we have a day where we celebrate kids, or we have a conference where we're going to bring together people who are willing to come and share their expertise and learn from each other. We can do a book club. It's taking what we can all buy into and participate in to help others.